Namaskaram, నా పేరు Dr.Sibasankar Dalai. I am the Chief of Neurovascular Intervention at Medicover Hospital at Visakhapatnam. Today we are going to talk about carotid artery disease. So what is a carotid artery? Basically, brain is an organ which needs the maximum amount of blood supply compared to any organ in the body. Because it's a supercomputer, it's a super active. That's why there are two direct major blood supply from the heart which connects to the brain. They are called carotid artery. So one is a right carotid artery, one is a left carotid artery. At the level of the neck, they will divide into external carotid and internal carotid. External carotid will go and supply to the face, internal carotid will go inside the brain. So this bifurcation, the division of internal and external carotid is called carotid artery bifurcation. So at the level of the bifurcation, because of the high pressure jet from the heart towards the brain, they might get damaged over the year as the patient gets elder. So వయసు ఎలాగా ప్రోగ్రెస్ అవుతుంది స్లోలీ దట్ వెసల్ డ్యామేజ్ అవడానికి ఛాన్స్ ఉంది. కెరోటిడ్ ఆర్టరీ బైఫోర్కేషన్లో కొంచెం టర్బులెన్స్ ఎక్కువ అయిన తర్వాత ఇది డ్యామేజ్ అవడానికి ఛాన్స్ ఉంది. సో దిస్ కెరోటిడ్ బైఫోర్కేషన్ డ్యామేజ్ విల్ స్లోలీ లీడ్ టు ఏ ప్లాక్ ఫార్మేషన్ అండ్ దెన్ బ్లాకేజ్ ఆఫ్ ద కెరోటిడ్ ఆర్టరీ. దే ఆర్ కాల్డ్ కెరోటిడ్ ప్లాక్ and we call it as a carotid artery disease. ఈ carotid artery disease ఉంటే ఏమి ప్రాబ్లం ఉంది మీకు? బికాజ్ దే ఆర్ ద మేజర్ బ్లడ్ సప్లై టు ద బ్రెయిన్. ఒకసారి చిన్న అయిపోతే బ్లాక్ అయిపోతే పేషెంట్కి స్ట్రోక్ అవుతుంది. ఈ స్ట్రోక్ సిమ్టమ్ FAST, ఫేషియల్ వీక్నెస్, ఆర్మ్ వీక్నెస్, స్పీచ్ వీక్నెస్ ఇలాగ సిమ్టమ్ వస్తే బ్రెయిన్కి స్ట్రోక్ అవుతుంది. అండ్ దట్స్ మేజర్ కాజ్ ఆఫ్ స్ట్రోక్ ఈజ్ carotid artery disease. Now who are the person who are at risk of having carotid artery disease? High blood pressure, high cholesterol, family history, sometime injury, and sometime there is a clot in the heart which might go and get stuck into the carotid. They are the reason for having a carotid artery blockage, and this carotid artery disease can be safely treated. There are two different types of treatment for carotid artery disease which are significant. One is surgery by carotid end arteriectomy, and one is without surgery, which is called a carotid artery stenting. So we do carotid artery stenting very commonly. I have treated more than 3,000 carotid artery stenting last 15 years. It's very fairly simple. From a small puncture in the hand or the leg, we go inside the carotid, we just open the block with a small balloon and we put an appropriate size stent after giving an umbrella device distally. And once the carotid stenting is done, we remove the umbrella device. Any clot is there, that is been removed. 99% safe to do a carotid artery stenting in our setup, and this is a fairly advanced treatment which is available for more than 20 years now, and it's a time tested treatment for carotid artery disease. So if you have a carotid artery disease, you can have a mini stroke or a stroke, or it can have a carotid bruit. And identify the carotid artery disease very simple. By doing an ultrasound, we can find out the carotid artery disease is there or not. Once you have, then we can treat you initially by medication, but if it is significant, we can treat you by a surgery or without surgery, most advanced carotid artery stenting. Suppose we have a suspicion that a patient is having a carotid artery disease, or anyone who is 40 plus, who is diabetic, who is having hypertension. It is ideal to do a checkup on a regular basis. Every 2 years, we can do a thorough body checkup with a carotid artery Doppler, which will tell us whether the carotids are fine or not. That can easily pick up the plaque formation so that appropriate medicines can be given to prevent or slow the disease process. So I recommend a regular health checkup, control of blood pressure, and a Doppler test for early detection of carotid artery disease. Hence a proper medications or intervention can be performed. How to prevent a carotid artery disease? Control your blood pressure, control your cholesterol, do regular exercise, maintain a good body weight and stress-free lifestyle. That will help us to prevent carotid artery disease. Thank you.